Hi, I'm Ellen, I'm a physio at myPhysioSA. Today we're going to be looking at some pain relieving techniques to help with your tennis elbow. So we're looking at the muscles that come on the outside of our elbow here. And so when you've got tennis elbow, sometimes the tendon in that area can get a little bit inflamed. With the exercise we're going to be doing, we're going to be holding our arm in one position to take load through that tendon. There's different ways that we can use the muscles in our forearm. So in my forearm, if I want to lengthen the muscle under load, I would lower my hand with the weight in it. If I want to shorten the muscle under load, I would lift it up. When you've got that tennis elbow, or that sore, irritated tendon, sometimes those movements can be quite painful, and you'll notice that with different things at home, gripping and holding objects. But a really good pain relieving technique that's starting to come through the research now is, again, this static kind of contraction that I'm talking about. So what you'll take is probably a 2 or 3 kilo weight, and you'll place it in the hand. Like I said, it can be a bit sore if you lift it up or drop it down. So just bring your wrist back into a slightly cocked position, and we're just going to place that weight in there. So in that position, I'm putting load through this muscle and through the tendon and its attachments through here, but I'm not lifting or dropping the weight, and that's really important. It's not the most exciting exercise in the world, and you are going to be there for a little while, so it's a really good one to just do while you're watching TV or playing on your phone. But what we want to do is see if we can hold that for about 45 seconds. So it's quite a long time, and we're just going to be holding that weight. It's a nice easy one. You can do it at your desk, you can do it in the lounge room, you can even do it lying down if you want to. But we just want to be activating through there for that 40-45 seconds if we can. After that, when you take a break, again, don't drop the weight down. That can be a little bit painful. If you just take the weight out of your hand and you can place it back in your lap, and maybe have a 30 or 45 second break in between. Okay, so it shouldn't feel painful. It may feel a bit fatigued, that's okay. But again, really making sure that we're not irritating the area. When you finish that break period, you can place it back in the hand and you can do it again. Another thing to think about is it's really important that the forearm is supported. So we don't want to be holding our arm up in the air, activating the muscles through our neck and shoulder. We really want to isolate it just to those muscles in the forearm for this exercise. So just to summarize, what we're doing is we're placing a 2 or 3 kilo weight in our hand, holding in this position for 45 seconds, and then having a 30 to 45 second break. We're going to do that 4 times, and then you might be asked to do that up to 4 times a day, depending on your pathology, and that's really a good question to ask your individual physio. So it's important that you're not feeling any pain or discomfort when you're doing these exercises. If you have any questions, certainly talk to your physio, or we are always happy to see you here in the clinic. Thank you.